Our teams around KwaZulu-Natal and Gauteng for you. The latest we have, Alexandra, it seems, certainly the parts of it that we've been able to see beginning to calm down. South African National Defence Force boots on the ground there, monitoring other situations for you. Meanwhile, the violence of the last few days having a huge impact on all sorts of services. You'll remember yesterday the CEO of a private hospital group telling Newzroom Afrika, Channel 405, how he had to get a police escort just to move an oxygen truck to his hospital. People also battling to get medicines. And then, of course, the vaccination sites in those two provinces. Mia Malan is at the Bhekisisa Centre for Health Journalism. Mia, good afternoon to you. Perhaps the most important thing we're doing as a nation right now, despite everything, is to vaccinate our people against COVID-19. This must have a big impact on that process.
Yes, Stephen, the impact has been pretty immediate because we saw it in last night's vaccination figures. We vaccinated about 146,000 people yesterday, and if we compare that to Thursday, before any protest had started, then there's a difference of 45,000, and most of that difference comes from KwaZulu-Natal. And KwaZulu-Natal on Monday only did about a tenth of the number of vaccinations that they normally do, and that is largely because vaccination sites had to close either because they were looted, private sites such as click shops where vaccination sites were based, or because health workers and patients couldn't get to the vaccination sites. And it very ironically happens at a time where we are in the best position in South Africa since the start of our vaccination rollout, with a number of vaccines that we have access to, and where more sites opened specifically in KwaZulu-Natal, but now couldn't operate. So now we've got the vaccines, but we can't roll them out quickly enough. And last Friday, the health department announced that the goal is now to scale up to 250,000 vaccines by the end of the week. And will that now happen? Because how do you do it if you can't get patients safely to a site and if you can't get the vaccinators there?
I mean, this obviously has all sorts of implications. There'll be people who have appointments, people who registered, and there'll be people who are very vulnerable to the disease. These are people who want that protection very quickly.
Absolutely. And the people we are vaccinating at the moment are older people, people of 50 and older, who are the people who are most likely to end up in hospital. And in most of our provinces, you see sharp increases in COVID hospitalizations at the moment. And now the situation that we're in is that there will be not just more patients because there's not enough, there's fewer vaccinations, but also that we already have more patients because people get injured in the lootings and in the protests. So doctors who already can't get to work, there's less staff at a hospital, now have to deal with more patients. And we have seen reports of patients fighting to get access to services where there's violence inside hospitals, particularly in Gauteng. So it's a really devastating situation. And the irony is also part of the looting is pharmacies in malls. And comorbidities such as diabetes and hypertension and HIV require medication, and the comorbidities become worse if they're untreated. And now many patients can't fetch their medication for comorbidities, which makes them even more likely to get severe COVID if they do get infected. So it's really a snowball effect, and part of the health department's efforts to reach older people, people of 60 and plus, was to go to pension payout points so that they can reach the people who haven't been vaccinated, who are older. And now cash in transit services don't feel safe transporting money to such points, and we've heard that that will now not happen this month, which means that the whole effort to try and reach those people who are more likely to end up in hospital is not going to be possible everywhere.
There's so many knock-on effects in this. I mean, what we're likely to see is that people who have been able to live with a condition for some time can't get the right medication. They could find themselves in a very difficult situation, and it's very difficult to actually get medical treatment at all.
Yes, it is difficult to get because it's not just difficult to get vaccinations or COVID treatment, it's difficult to get to a health facility because of the danger in the road and in the journey that you're going to travel. So people, for instance, need to collect HIV medication. Many of them have had trouble, for instance, yesterday in Hillbrow at a clinic to do that. And part of this protests is that it's super spreader events in the sense that no one social distances when they are in a protest. Very few people wear masks. And today we saw many people being arrested by the police, which is great. But we know that congregate settings such as prisons are also very environments where COVID spreads very, very rapidly. And those people are now many people who've been arrested. They'll all go to already under-resourced prisons and stretched to capacity. And that in itself already presents an opportunity for super spreader events.
So, I mean, we have super spreader events. We've seen a couple of big political events before this. We've had a big spike in the number of infections, although, and again, I don't know if this is also because of the violence, if there's been disruption to the usual results process or the testing process, because we didn't see as many, if my memory is correct, we didn't see as many new cases yesterday as we'd seen, say, a week ago.
But what we have seen is we've seen a very high positivity rate, and that is the thing that we can consistently use to measure how bad infections are, because regardless of how many new cases we recorded for a day, we want to know what percentage of those cases are positive. And at the moment we see about 1 out of 3 cases being positive. In provinces such as Limpopo, where the Delta variant is spreading the fastest at the moment, we see positivity rates as high as 45 or 44% on various days. So at the moment, for instance, in Gauteng, we will see some of the cases going down a bit because we've reached the peak in Gauteng. But the issue is that we're going to see hospitalizations going up because it takes time to fall from the time that you get infected until you end up in hospital. So we still have to reach our hospital peak here in Gauteng. And this is now in the midst of these protests where doctors can't get to hospitals, where there are more patients because of trauma cases, of people getting injured coming to hospitals, and also people with comorbidities finding it hard to get access to their medication.
The problems, of course, mount up and mount up and mount up. We have health workers already exhausted, already battling. We've got a healthcare system that hasn't really been able to cope at some moments with the load. We've put the violence on top of all of this, and what we really have is a recipe, I'm afraid to say, for disaster. The stress is going to be too much. There are going to be some people who won't receive the treatment that they need.
Absolutely. It's the situation we're in, and there's no way that we can speed up or increase the number of vaccinations we currently do without calming down the violence and making it possible for health workers and for patients to get to clinics and for people to feel safe.
Mia Malan, I do appreciate the time. Thank you very much indeed. The founding editor at the Bhekisisa Center for Health Journalism there. Well, in